chest pain choice. Assume that the patient and clinician have both been previously consented. This is what the intervention will look like.
Hey, Miss Benseal.
Hi.
It's good to see you again.
Good to see you too.
How are you feeling?
I'm feeling better, but still concerned. Yeah.
Your chest pain is still gone.
It's still gone, but I'm still
Excellent.
worried.
Of course.
Yeah.
As I would be if I were in your situation. So I'd like to just summarize what's happened so far, to give you some insight as to why we do things, as well as talk to you about some next steps.
Okay.
All right, so when you first came in the emergency department, whenever you say you have pain between here and here, we're concerned it might be a heart attack or something serious.
Right.
So that's why you had like the sticky and all
Yeah.
these things put on you. That's why
Yeah.
you're on the monitoring. You had a lot of things fast.
Yeah.
So you got oxygen stuck in your nose, which now is gone, thankfully.
Yeah.
And when we first talked, I told you we were thinking about some of the serious causes of chest
Right.
pain.
Yeah.
And at this point, all of your test results, your initial test results, are back. And we can confidently just focus on whether or not your pain is due to your heart, rather than
Okay.
the other potential serious
Okay.
causes. Okay. So we've put together this decision aid for you.
Okay.
Okay. So that I mentioned earlier, we're going to focus on next steps.
Right.
So when you first came in, you had that pink tracing, the electrocardiogram with all the stickies.
Right.
That helps us look for evidence of heart damage or a heart attack. That was reassuring. We didn't see anything worrisome on that.
Okay. No heart damage. Okay.
That was good. The other thing we did is we drew some blood from you.
Right.
Okay. One of the key results of that is whether or not there's evidence of heart attack or heart damage in the blood.
Okay.
Our first test came back and it was negative or reassuring.
All right.
So your initial evaluation told us two things. First of all, we can focus on your heart, and second of all, our initial results are reassuring.
Okay.
Okay, so that's where we are. So the standard here is to make sure you haven't had a heart attack. We'll need to do 2 more blood tests in the next 5 hours.
Okay.
Okay,
So stay here and do 2 more
Right.
blood tests.
and what we'll be focusing on now is after those 2 blood tests have been drawn, and presuming they're also negative or reassuring,
Okay.
what would your next step be? Okay, that's what we're going to be
That's
talking
what we're
about now.
looking at now.
Okay, so the next possibility to consider would be a stress test. And our stress test, like after taking all the blood tests, we can tell you confidently that you have or have not had a heart attack,
Okay.
but we're not able to tell you what is your future risk very well. So the stress
The
test will
stress
help
test.
refine what your risk of a pre-heart attack is.
Is that like a treadmill?
That's one of the more common
Okay.
ways of doing that.
Okay.
And in your case, you can exercise, you can walk 2 blocks, and can you walk up 2 flights of stairs?
Yep.
Okay, so, and your initial electrocardiogram suggests that that's a reasonable approach.
Okay.
Okay, so
All right.
that'll be consideration, whether you want that sort of test now, or if
Okay.
you want to have further evaluation in the clinic. So that's the
Okay.
decision, okay? So, based on 8 characteristics such as age and gender and so on that are specific to you,
Okay.
we can tell you what your risk of a heart attack or a pre-heart attack in the next 45 days is.
Okay.
And that's what this shows us here.
My risk.
Your individual risk.
Okay.
It says of every 100 people with factors like yours, 4 people had a heart attack or pre-heart attack in the next 45 days and 96 did not.
Okay.
This is a picture that shows you the same thing.
Okay.
These 4 are the people that had a heart attack or pre-heart attack in the next 45 days, and these 96 didn't.
All right. Well, that's just knowing that is very reassuring. I
Good.
feel good about that. Okay.
Yeah, good. So that's our situation now, and so we have 4 treatment options for us, and they're all listed here, and you'll get a chance to read them
Okay.
once I leave the room.
All right.
I'll just summarize them briefly. Okay, so the first one is after you've had those 2 blood tests, you just want to hop on the treadmill and get the stress
Here.
test here.
Okay.
The second option is once you've had those 2 blood tests and they're not normal, that we could arrange an appointment with a heart doctor here in the next 72 hours, next 3 days.
So in St. Mary, in the hospital here?
It's a
Or in
clinic
the
that's
clinic,
in the same
okay.
building,
Okay,
but we could essentially hand you an appointment
and that would
She'd-
be within the next 2 days,
the next 3 days.
next 3 days, okay.
Yeah. The third option is if you would prefer to see your own primary care physician, but it would make me feel better if I knew you could see your own doctor within 3 days.
Okay,
And if you choose that option, I would probably still provide you the appointment
just
as a
in
backup.
case I couldn't see my doctor, okay.
Right. And
Alright.
then the third option is, this has been a long day and this is something that you'd just rather have me make the decision for you. And maybe you don't feel like you have sufficient family support or whatever you need to make the decision right now.
Okay,
And I'd be happy to do that on your behalf if
okay,
that's what you desire. So those are our 4 options. Why don't, I'll give you a chance to contact one of your family members.
Okay.
Understand they're not here right now, you'll probably
right.
need to call
I'd like
them.
to call my husband, yep,
And then I'll come back in a few minutes once you've had a chance to read through this and talk with your
okay, great.
husband.
Good.
And then we'll go from
And
there.
then make a decision,
Yes.
okay. Okay, that sounds good.
Okay, great. I'll be back in a few minutes.
Okay, sounds good.
All right.
All right,
Were you able to reach your husband?
I did, I had a chat with him and kind of went over the options with him, and I guess
Okay.
what I'm thinking is, so if I wanted to have, after the 2 other blood tests, if I wanted to have the stress test here, and that was okay, then I could leave tonight?
Most likely. So right now it's, just give me a second. It's 3:35. You have 4.5 to 5 hours more. That's after our stress test lab would close.
Okay, so I couldn't have it
So you would
tonight,
you would end up staying here all night
okay,
if you chose that option.
okay,
Yeah, so that would be involved if you decided to have the stress test here, as we often do.
okay. So if I wanted to follow up with my own doctor, would I wanna come back for the stress test here, or would I just do that with?
We would essentially arrange an appointment with that doctor,
Uh-huh,
and they have immediate access to a stress testing lab.
okay,
Um,
okay.
So it would be done that day if that's what you had decided with the cardiologist or your doctor.
Okay. Well, I really would like to see my own doctor.
Okay.
Um,
So your own primary care doctor.
my own primary
Okay.
care doctor, and she's in town, but if she's not available, then you'd set me up with an appointment with a cardiologist?
Yeah, yeah. So
A backup.
when you leave here, you'd still have in your hand
Mhm.
an appointment with a time and a place to go.
Okay,
And if it works out for you to see your primary care doctor, I
Mhm.
prefer you just call and let those people know.
okay,
But that would be a nice backup in case
Mhm.
your primary care doctor decides to leave town or.
okay. And then if I did have, would it be if I had more, if I left and went home, if I had a return of the chest pain, then should I come back?
Yeah, absolutely.
Okay,
Yeah, if you have
Okay.
worsening symptoms or recurrent symptoms,
okay,
we're open all day,
okay.
all night. And so
Okay.
we're always available if that were to occur in the meantime.
Okay. Well, I think that's what I'd like to do then. I feel
Okay.
this really helps, because for me, this is a low risk. I
Okay.
know that it still could be, but, I feel safe being in Rochester, being close, to the
Mhm.
hospital. And I'd really, like to see my own clinician if I could, so
Okay.
that's what I'd like to do.
And so far, I mentioned that we've done the blood tests and the electrocardiogram. We've only had one blood test.
Okay,
And this is your risk after the first blood test.
after the first blood test?
Right, so if you have 2 more blood tests
Okay.
that are also negative, it would be even lower than this number
Really?
here.
Really?
So we don't have great data to tell you exactly how it might change, but it's even slightly lower than that.
Okay, so that would be even more reassuring.
Yeah,
for
if the
me.
next 2 blood
Okay.
tests are negative.
Okay, so let's wait and see what they say.
Yes, sounds good.
Okay.
All right.
Sounds good.
All right, thank you.
Thank you.